hope that at the end of this session, participants will be more informed about the Africa Sanitation Policy Guidelines. They will better understand the Aspg and how to use it. They will also understand the support systems available towards adopting the Aspg and how to access the support. And they will understand how they can support the process for uptake and use of the Aspg. My name is Kich Bauer, the Sanitation Project Manager at AMCAO, your moderator for today's event. As you may be aware, the chat function is disabled, but you can send in your comments on the Portable platform from which you join this event. And also you can be able to ask questions directly from Zoom during the Q&A session. We will do our best to address the questions you send in through Portable chat during the Q&A. Please note that the event will be, Now then, ladies and gentlemen, please allow me to welcome the Acting Executive Secretary of AMCAO, Mr. Thomas Banda, to officially welcome you to today's event. Over to you, Mr. Banda, for the welcome remarks.
Good afternoon, good morning. Your Excellency, Kawa Shretwin, the AMCO President and Minister of Agriculture, Water and Land Reform of the Republic of Namibia, Your Excellency, Engineer Suleiman Adam, the Honorable Minister of Water Resources of the Federal Republic of Nigeria and the AMCO Vice President for Western Africa, Honorable Ministers of the Governing Council of AMCO here present, distinguished members of the AMCO Technical Advisory Committee here present, distinguished panelists, Mr. Eric Momanyi, representing the Bill and Melinda Gates Foundation, and Dr. Kerry Ann Nera, representing UNICEF, AMCO collaborators, partners, and friends, distinguished participants at this year's World Water Week, ladies and gentlemen. It gives pleasure to welcome you all as AMCO delegates to the Stockholm World Water Week 2021. I must say we are indeed very grateful to have you join the AMCO session despite the many competing sessions we have out there. As you are already aware, the general theme of this year's World Water Week is building resilience faster. But resilience cannot be built without access to safe sanitation and hygiene. We all know that access to safe sanitation and hygiene are prerequisite for a healthy and productive livelihood. Presently, COVID-19 pandemic has further drawn our attention to the critical role of hand hygiene, and we need to build on this hygiene behavior. Accelerating access to safe sanitation and hygiene is impossible without a strong enabling environment whose foundation are strong policies and strategies. The African Sanitation Policy Guidelines, the Aspg, as you already know, has been developed to ensure that our sanitation and hygiene policies and strategies respond to the present and future challenges. This session has been convened with member states and partners to discuss how we can improve sanitation in Africa through the African Sanitation Policy Guidelines. Excellencies, distinguished guests, ladies and gentlemen, having just launched the Aspg 2 months ago, it is important to further dialogue on how we can all work together to support our member states to uptake the Aspg and to mobilize resources and build the needed capacity for implementation. Since the launch of the Aspg in June 2021, AMCO has developed a rollout strategy for the implementation of the Aspg. In this rollout strategy, we have formed the policy coordination platform, created the Aspg demand form, and developed country policy assessment tools and a framework for tracking of progress of the Aspg with clear indicators. I'm sure the presenters will elaborate on this during the session. Distinguished guests, ladies and gentlemen, you agree with me that implementing the Aspg across Africa demands a collective effort. AMCO alone cannot do it. This session is meant to trigger further discussion on how best we can effectively collaborate on the rollout of the Aspg. Distinguished guests, given the panel is assembled for this program, I have no doubt that justice will be done to the topics for discussion. I'm very confident that at the end of the day, we shall be more informed about the African Sanitation Policy Guidelines, understand the support mechanisms available to adopt the Aspg, and how to assess this support. Our partners and collaborators will also understand how they can support the process for the Aspg uptake and the innovative ways of accelerating the mobilization of funding for implementation of sanitation policies. Excellencies, distinguished guests, ladies and gentlemen, the more we have many countries uptaking and using the Aspg, the greater our chances of building resilience faster towards achieving the Sustainable Development Goals 2030 and the Africa Agenda 2063, the Africa we want. Distinguished guests, on this note, AMCO looks forward to collaborating with you all, our old and prospective partners, to enable us improve the sanitation enabling environment of the African continent. Once again, I wish to warmly welcome you all to this discussion, and I hereby declare this session duly opened. May God bless you. Thank you.
Thank you too, Mr. Thomas Banda, the Acting Executive Secretary of AMCO. And now, ladies and gentlemen, to the main focus of the day. As we have said always, the Aspg was not designed to be kept on the shelves. There's an echo. Somebody. This was underscored by countries and other stakeholders during the consultations. The Governing Council of AMCO in the General Assembly in February directed the Secretariat to not just coordinate the rollout of the Aspg, but to document, to monitor, and to report to it, the Governing Council. Therefore, following this directive of the ministers, we have developed a comprehensive rollout strategy with supporting documents to ensure uptake is smooth and the standard set in the guidelines is followed. I will now hand you over to my colleague, Comfort Kansho, Sanitation Support Officer, to give you an overview of our rollout strategy. Over to you, Comfort.
Thank you very much, Keith. Good morning, good afternoon, distinguished guests. My name is Comfort Kansho. I work for the African Ministers Council on Water, and I'm going to be taking us through the Aspg rollout strategy. Just give me a moment to share my screen. Okay, great. So this afternoon, I'll be talking about the African Sanitation Policy Guidelines Rollout Strategy. My presentation will follow this format. First, I'll talk briefly about the African Ministers Council on Water, for those of us who may be hearing about AMCO for the first time. And then I'll talk briefly about the African Sanitation Policy Guidelines, and then we'll dive into the Aspg rollout strategy, and then opportunities for stakeholders to get involved in the Aspg rollout. So the African Ministers Council on Water was formed in 2002 in Abuja by the African heads of state, and it is a delivery mechanism on water and sanitation of the Specialized Technical Committee of the African Union. Our vision is an Africa where there's equitable, sustainable use and management of water resources for poverty alleviation. And our mission is to provide political leadership, policy direction, and advocacy in the provision and use and management of water resources for sustainable and socioeconomic development. In 2018, AMCAL developed its strategy for 2018 to 2030 period. Now, this AMCAL strategy had four strategic priorities, four strategic pillars. Strategic pillar 2 of the strategy aims to ensure safely managed sanitation and hygiene. And it is under the strategic pillar 2 that the ASPG was developed. Now, just briefly about the ASPG. The ASPG was developed to guide African governments, policy formulators, and implementers on the content and process of an inclusive sanitation policy. It can be applied in the review, revision, and development of sanitation policies and implementation strategies. While we recognize that sanitation is broad and includes environmental waste, solid waste, and all of that, the ASPG scope is limited to fecal waste and hygiene. For fecal waste, the limit is on human urine, feces, and anal cleansing materials, and hygiene is limited to menstrual blood management and hand washing with soap and water. The ASPG was developed through a series of consultative process, and the idea was to ensure that it captures the critical gaps that exist in sanitation policies. Stakeholders across member states were involved to provide input, and global stakeholders as well were involved in the process to ensure that the content of the ASPG aligns with global standards and current sanitation realities. Now, content of the ASPG. The ASPG document has 4 parts and 11 chapters. Chapter 1 focuses on what are the guidelines, what are they about, what are the scope, what is the scope, how to apply the guidelines. And chapter 2 focuses on policy development process. So the decision-making process that guides a country to the point of understanding the context of the sanitation policy and at what process of ASPG adoption they should follow. And part 3 has 7 chapters, and this is the core of the document because it prescribes the core elements that should be involved in that, or that should be included in sanitation policy. So elements around vision, objective, principles, sanitation service systems, hygiene, behavior change, regulation, financing, and capacity building. All of these are contained in the ASPG, and they can be found in chapter 3 of the document. Now, you agree with me that without an implementation strategy, it might be difficult to achieve, for countries to be in the path towards achieving the Sustainable Development Goal 6.2. So the ASPG also gives guidance on how to develop an implementation strategy that aligns with the policy, and also how does a policy differs from implementation strategy, and what should the process of developing an implementation strategy be. So all of these are well detailed and captured in the ASPG document. Now, the ASPG document was launched on 10th of June 2021 by the AMCAL president. And following the launch, AMCAL have been involved in lots of activities to ensure it is effectively rolled out and it achieves the aim the reason why it was developed. So some of the activities that are involved in the rollout strategy is aligned, and these are the components of the ASPG rollout strategy. So I'll be taking us through each of those components. So in line again with the AMCAL decision from the Governing Council, there was a decision that was given to AMCAL during the AMCAL General Assembly, as said earlier, and the decision says we should launch the ASPG, coordinate it, and monitor the rollout. So in line with that, AMCAL developed ASPG uptake tracking system to monitor the ASPG uptake. Now, in order to do this effectively, AMCAL developed what we call Sanitation Policy Assessment Tool. The Sanitation Policy Assessment Tool is in line with the content that is prescribed in the ASPG document, and the assessment tool will be used to assess the sanitation policies of the 55 African countries. Findings from this report will be uploaded on the AMCAL website on what we call the ASPG uptake dashboard. Now, following these, AMCAL, there is also a component of the rollout strategy, that is policy benchmarking. So what this is about is the findings from the sanitation policy will be categorized and weighted from 0 to 5. Now, this weighting will then be this, and that is called the Africa Sanitation Policy Index. That weighting system is called the Africa Sanitation Policy Index. Sanitation policies will be mirrored against this weighting system, and then based on their compliance or based on their alignment with the ASPG, they will be ranked either 2/5 or 3/5. So if, for example, the sanitation policy is 0, it means little to 0 alignment with the ASPG, and that will be represented by the color red. Now, if the sanitation policy is mirrored against the ASPG and its total compliance, that it means that sanitation policy will be given the color green, and that shows total compliance with the ASPG. So the AMCAL monitoring system would then monitor for countries that are between 2, 3, or 4, would then monitor the progress of this country as they comply with the ASPG, as their sanitation policies improve and is compliant with the ASPG, and the result of the progress in the sanitation, in adopting the ASPG would then be reflected on the ASPG dashboard, and the colors will be green, showing that all the sanitation policies are in line with the ASPG. Now, the next component of the rollout strategy is what we call the demand management system. A critical part of the demand management system is the ASPG demand form. The ASPG demand form contains a set of questions that first of all support member states to indicate their commitment to uptake the ASPG. Also, there are questions that will make member states to, in response to that question, they will tell AMCAL if they have resources available, if they have the technical support, and when they would want to uptake the ASPG. So this demand form is right now uploaded on the AMCAL website, and countries that are interested or partners that are interested in using the ASPG can go to the AMCAL website and fill that form and submit it. Once we receive the form, we will analyze the findings and categorize countries based on their level of support, and then we will get in touch with them and take it up from there. Now, there are several partners are involved in the ASPG the implementation. So many partners have indicated interest in supporting the ASPG implementation in the countries where they work. However, this cannot be effectively done if there's no proper coordination. And again, in line with the AMCAL General Assembly decision for AMCAL to coordinate the process, AMCAL has gone a step further to establish what we call the Policy Coordination and Engagement Platform, and that is called, we call it PSEP for short. Now, this brings together numerous partners interested in supporting ASPG implementation in the countries where they are present. The idea of this platform is to ensure smooth implementation of ASPG across countries and to ensure that the ASPG is implemented in a uniform, coordinated manner. The platform also serves as an information sharing platform so that every member present on that platform will be able to understand what is happening in country A in terms of ASPG implementation and what is happening in country B in terms of ASPG implementation. Knowledge will be shared and then lessons will be learned so that subsequent countries that will be implementing the ASPG will learn from it, and then the process will be effectively and well coordinated. Another component of the ASPG rollout strategy is high-level stakeholder engagement. Now, AMCAL intends to create awareness on the ASPG uptake at various platforms and to ensure that the ASPG is adopted and commitment is being from high-level member states is being indicated for ASPG uptake. One of the ways we intend to do this is working through the EXCO to ensure that the ASPG is endorsed at the Specialized Technical Committee of the AU, and to ensure that other ministers responsible for sanitation across African countries are well informed of the ASPG and ready to uptake the ASPG and allocate the needed resources to ensure that the ASPG is implemented in their country. Now, capacity building. A critical component also of the ASPG document is capacity building, and we intend to really bring that to the fore in the screen. Yes. Oh, great. Sorry about that, also a technical problem. Yeah. So the last component of the ASPG rollout strategy is the technical backstopping. Now, different partners, different countries will be implementing the ASPG. We need to ensure that there are experts on ground in the different elements of the ASPG to ensure that whenever a country needs support, we are right there to provide the support for the country. So one of the things AMCAL is doing is to create a database of experts, of sanitation experts. And this database will cut across the different elements of the ASPG. So for the ASPG has financing, monitoring and evaluation, regulation, and all of these components. We will be getting experts across from our partners and updating our database with the names, organizations of these experts, such that when a country needs to implement the ASPG, we will then link up the experts with that country to support the country in developing the different sections of their sanitation policy. Like, you know, sanitation policy ideally should be developed by different people. One person shouldn't develop a sanitation policy. So we need experts to develop the different critical components of the sanitation policy to ensure that it is robust. Now, there are several ways stakeholders can get involved in the ASPG rollout strategy. For starters, member states to get involved in the process, we encourage member states to visit the AMCAL website and fill in the country demand form to indicate their willingness and readiness to uptake the ASPG. And this is the link to the ASPG country demand form. But again, it's available on our website. Donors can also support directly the ASPG implementation. You can choose to support one of the components of our rollout strategy, for example, around coordination or monitoring. And our hands are wide open to welcome donors who are willing to support the process and ensure that the ASPG is adequately implemented across member states. And you can choose to support policy development in country directly. We are also open to that option. If that is what a partner wants, we are open to receiving that. You can work through us to support countries to develop their sanitation policies. Just let us know what country you would want to support, and we'll take it up from there. There is also an opportunity for individuals, freelance consultants, to support the process. So you can support by giving your time to technical support. So we encourage technical experts to indicate their interest. We will add your details to our database, and then we would get in touch with you when it's time to support countries to develop their sanitation policies. And also, like I said earlier, there is what we call the Policy Coordination and Engagement Platform. Members are welcome, organizations are welcome to join, to sign up for and join the platform. We have the TORs available, and we have every resources that you would need to understand what the platform is about, when we hold our meetings, and how you can effectively support in the process. I thank you very much for your kind attention, and I'm we're happy to take any questions that you may have. Thank you.
Thank you very much, Comfort, for running us through the echo. We are still open for questions if you have any. Okay, there's none yet. So we will continue with the next item on our agenda, which is the moderated panel discussion on ASPG rollout and adoption. And for the sake of, we have decided to record all the interventions from the panelists, so we'll play them in the order that I will be introducing. And the first panelist on this panel is Honorable Suleiman Adamu. Honorable Suleiman Adamu is the Minister for Water Resources, the Federal Republic of Nigeria. But for this occasion, he will be speaking in his capacity as the AMCAO Vice President for West Africa. And he will be talking to us briefly about how AMCAO is mobilizing political support for ASPG rollout and adoption at the Governing Council level. Give me a second to share my screen and I will play the intervention of Honorable Suleiman Adamu.
Of the African continent cannot be overlooked. Your Excellencies, Honorable Ministers of the Governing Council, African Union member states, gentlemen, it is with great pleasure that I interact with you today on the African Sanitation Policy Guidelines, ASPG, since the rollout. Let me first take this opportunity to congratulate the Secretariat of the African Ministers Council on Water, AMCAO, for the successful completion and launch of the ASPG. The importance of sanitation and hygiene for the socio-economic development of the African continent cannot be overemphasized. Yet, only 21% of the population have access to safely managed sanitation, with 18% still defecating in the open. Also, only 20% of the population have access to basic hand-washing facilities with soap and water. The emergence of the COVID-19 pandemic has further compounded the situation, but also brought to fore the importance of safe sanitation and hygiene practices. Overcoming these challenges demands inclusive sanitation and hygiene policy, which is the cornerstone of the enabling environment. The INGO report revealed that some progress has been made on the enabling environment for sanitation and hygiene in Africa, but member states need to accelerate action towards achieving SDG 6.2 targets, and the ASPG provides such guidance for the development, review, and revision of inclusive sanitation policies. The elements of the ASPG are also consistent with the UN Accelerator Framework for achieving the SDGs, which includes financing, capacity development, innovation, governance, and generation of quality data. At the 12th General Assembly meeting in February this year, we mandated the Secretariat to provide the needed support to member states to use the ASPG through this decision, that the GA directs the AMCAO Secretariat to launch, implement, coordinate, uptake, monitor, and report progress on the ASPG uptake. As the AMCAO Vice President for the West Africa region, I was delighted to see the swift approach and dedication of AMCAO and member states at the ASPG launch. While this is laudable, there is still more work to be done, as without implementation, the ASPG will just be another book on the shelf. I believe that with the steadfastness and cooperation of African governments, stakeholders, and donor agencies, the ASPG will achieve the purpose for which it was developed. I'm also delighted to know that following the directive given to the AMCAO Secretariat, it has developed the post-ASPG strategy with clear implementation activities, beginning with an assessment of existing sanitation policies, strategies, and plans of the AU member states. I'm also happy that the Secretariat is also putting in place a system for coordination of partners through the establishment of the Policy Coordination and Engagement Platform to ensure a coordinated process for the uptake, share lessons, and learn from one another. The Aspg framework has been used by the Secretariat to develop a policy benchmarking system for rating sanitation policies across the continent. The Africa Sanitation Policy Index ASPI is a welcome development and will help all the countries on the continent to measure how comprehensive and effective their sanitation policies need to be to help them accelerate progress towards achieving national, regional, and global sanitation targets. It is indeed exciting to know that the Secretariat has developed an ASPG uptake tracking system in response to the General Assembly's directive, and I look forward to the progress report at the next General Assembly. To ensure that the ASPG is given the desired prominence at the continental level, from adoption to implementation of the policies, the ASPG has been submitted to be endorsed at the Specialized Technical Committee, STC, of the African Union Commission. It is our desire that the ASPG is endorsed by the heads of state in the upcoming summit during the World Water Forum in March next year in Dakar, Senegal. This will unlock the needed resources for the ASPG uptake and for sanitation improvement across the continent at large. In conclusion, I would like to call on development partners, donors, senior government officials, and the member states to provide AMCAR with the needed financial and technical support to effectively roll out the ASPG towards increasing access to safely managed sanitation and attainment of the INGO and SDGs targets. I understand that some countries are already using the ASPG to improve their sanitation policies, and I urge all leads in sanitation ministries to commit to using this valuable tool to improve the enabling environment for sanitation improvement and fast-track access to sanitation across the continent. Nigeria is still working to use the ASPG to improve its sanitation policy, as we promised during the launch of the ASPG. And as I said earlier, I look forward to receiving updates on the ASPG implementation progress. I thank you all for your attention.
Thank you very much, Honorable Minister. And now the next intervention is from the first country to uptake the ASPG. And we have a recorded intervention from Mr. Kimanti Chengo. And Kimanti Chengo is the Acting Director of Sanitation Management in the Ministry of Water, Sanitation and Irrigation, Kenya. And Mr. Chengo will be giving highlights to us on the country-level engagements on ASPG adoption, where he'll be talking to us briefly about the experience of Kenya as the first country to use the ASPG. Hold on while I share my screen.
Good morning, good evening, good afternoon to all the colleagues, and it's a pleasure for me to join you this forum, this session during the Stock Motor Week, to highlight some of the aspects that relate to policy formulation in Kenya. I'm Engineer Chengo, the Director of Sanitation Management in Nairobi. The process of the sanitation policy formulation in Kenya was developed because of the constitutional requirement that guarantees reasonable standards of sanitation, and also because of the devolved framework that we have in Kenya, which has mandated the regional and county governments, the water and sanitation mandates. We have also subscribed to the SDG framework, and this discussion, this deliberation was addressed comprehensively during a sanitation conference in 2019 in Nairobi, where there was a level government commitment to take the sanitation space to make deliberate efforts to grow and reform the way we are undertaking our service provision to Kenyan as far as sanitation is concerned. Currently, we are at a safely managed sanitation access of 27%, which is unsatisfactory for us and for as a government. As required by the Constitution, the process of developing the framework adopted a fairly highly participatory and inclusive approach, including all stakeholders, both from government and from other partners that are involved in this particular space. The aim of the extensive public consultation, which involved about 13 steps, was deemed essential for a number of reasons: creating policy ownership and support, awareness creation, sharing on information and knowledge, sharing, learning, identification of priority needs, formulation of policy strategies, and consensus building, among others. Engaging the various categories of stakeholders included relevant ministries, departments, and agencies, both national and county government, and state actors, community groups, consumers, and development partners. And this enabled us to come up with a more inclusive, effective, harmonized, and responsive policy document as information, views, perspectives, experiences, and insights generated were shared by the stakeholders themselves directly during the policy consultation. The main purpose in general was to ensure inclusive and maximum input of the public as diverse stakeholders. Specifically, we aimed to seek public and stakeholder views and input in policy formulation process. We allowed the stakeholders to air particularly their vision, issues of concern, and priorities for the design, framing, and content of the policy. We got stakeholder feedback on analysis and policy proposals and strategies, and we enabled the stakeholders to exercise greater responsibility of the various stages of the policy formulation. So it allowed a step-by-step process of learning and collection of views and thoughts on this policy formulation. The policy is guided and spearheaded by a steering committee that was constituted from various ministries, relevant ministries, government agencies, and state actors and community groups. This also included some of the actors in the sanitation space, including the private sector. This particular process went through a national and regional consultation, through various workshops, and it was very much guided by the Aspg, the African Sanitation Policy Guidelines. We embraced this process of the guidelines because we thought it was very inclusive, comprehensive, and gave a very fair contents that enabled us to really get the process moving forward. It really helped us a lot in terms of looking at the content of the policy, and it's a very good tool that was confirmed by the participation of the various stakeholders in that process. They thought it was comprehensive enough to address the needs of Kenyans as far as sanitation management is concerned. We have now been able to go through the regional collection of views, second round of validation process, and then a national validation process. What is remaining is for us now to engage the legislative arm of the government and a final round of consultation with the county governments to ensure that we have a sector policy that can be adopted and that can be taken up for implementation. We foresee that in the later quarter of this year, we'll have a policy in place, the Kenyan National Sanitation Management Policy, that will guide the sector to ensure that we address the needs. We regulate the whole value chain, sanitation value chain, and we're able to provide reasonable standards of sanitation to Kenyans as obligated by the Constitution. This, we are convinced, has been supported fully by the Aspg as far as giving us the way to go forward. Thank you very much, and I submit.
Thanks to Mr. Tengo Kimanti of the Kenyan Ministry of Water, Sanitation and Irrigation. And now we go to the next panelist on our panel, and that is Mr. Eric Momanyi, Senior Program Officer, Global Policy and Advocacy, Water, Sanitation and Hygiene at the Bill and Melinda Gates Foundation. And Eric will be talking to us, giving us a donor perspective and on resource mobilization for the Aspg rollout. Hold on while I share my screen with Eric's intervention.
Your Excellency, Honorable Suleiman Adamu, Minister of Water Resources, Nigeria, distinguished panelists, ladies and gentlemen, good morning. So the Bill and Melinda Gates Foundation congratulates MCOW for successfully steering the Africa Sanitation Policy Guidelines process from the beginning to the end. We partnered with MCOW and other partners, most notably the World Health Organization, the Center for Water Security and Cooperation, and Speak Up Africa, to create a platform on which countries will build on to develop inclusive sanitation policies that position African countries to accelerate progress towards SDG 6.2. So, as somebody who has followed the Aspg process quite closely, I'm glad to note that aside from delivering a document that governments will use when developing new or revising existing sanitation policies, it ignited an important conversation on the status of sanitation on the continent. The consultation process that MCOW led was useful in showcasing the successes that some countries have experienced, while highlighting the challenges that these same countries face. MCOW incorporated the results of these consultations to shape the content of the guidelines to ensure that the Aspg is relevant to the issues of the day. Now, developing the Aspg was just the laying of the foundation for the important work of streamlining and strengthening the enabling environment for sanitation in Africa. Now, while the launch of the Aspg in June of this year was a highlight, the real value of the Aspg will only be realized when countries adopt them into their own national policies. In 2021, as we speak today, we only have 9 years remaining to the day in 2030, when the verdict will be out as to whether we achieved the SDG 6.2 or not. We are aware that it takes time and resources, both human and financial, to support the adoption of new policies and implement them. Unfortunately, time, money, and human capacity are all in short supply at the moment. Now, while the Bill and Melinda Gates Foundation took this step to support MCOW this far in the Aspg process, we are aware that the resources required in the next phase of country adoption will be much more than we can offer. It will require countries, bilateral partners, foundations like ourselves, development finance institutions to pull resources together to meet the moment that is before us. Several existing policy support partners are at hand already to support at least 9 countries across different regions on the continent to support the Aspg, to adopt the Aspg with foundation support. Now, Speak Up Africa, the African Population and Health Research Center, WaterAid, and UNICEF with foundation support, will work with a total of 9 countries to support national coordination mechanisms that include stakeholder consultations, technical assistance support, research, evidence, research and evidence rather, and some consulting support. We are keen to work with partners who have their own seed resources in their policy development processes. We are supporting Speak Up Africa to host a partner learning and information sharing platform in support of the ASPG. We are also in discussions with MCAL to support them in their convening role in support of widespread adoption of the ASPG, as well as ensuring that government voices are prominent at the regional level. Now, the support to the African Population and Health Research Center will also enable them to develop guidelines that will hopefully support gender integration in national policies. Lastly, we are also working on a tier support mechanism that will broadly be available to a number of countries beyond the 9 that will be prioritized as mentioned. So in addition to the above, we believe that a sector coordination mechanism that brings together DFIs, regulators, utilities, and the private sector, as well as government partners, will connect the important work happening at the policy level with financing, regulation, and private sector development or participation in efforts to ensure that national mechanisms that deliver safely managed sanitation services work together a lot more optimally. We will be consulting closely with partners to figure out what form this coordination would look like. Now, the window of opportunity that has been opened by the ASPG is an important one, and I call on all development partners to step up to expand support to the many countries that have stepped forward ready to adopt the ASPG. So finally, in addition to the above, I want to highlight that over the last 10 years, the Foundation has invested significant resources in research and development to develop innovative new sanitation technology solutions that will complement an improved enabling environment that is made possible by the ASPG. These technologies that are mainly in service of non-sewer sanitation value chains are coming to market through private sector commercial partners. Now, I hope that this new era of political commitment, inclusive sanitation policies, and breakthrough innovation is the perfect recipe for a new era for safe sanitation for people around the world. Thank you.
Thank you too, Eric, for those wonderful remarks. And ladies and gentlemen, last but not the least of our panelists is Kelly Anelo. And Kelly is the Associate Director, Water, Sanitation and Hygiene at UNICEF. And she'll be talking to us about technical support and partnerships for ASPG rollout and adoption. Hold on a second while I share my screen with Kelly's intervention.
Part of this session. Permit me once again to congratulate MCOW, Executive Secretary Thomas Banda, Kitch, Bawa, Comfort, and the whole team of partners and sanitation champions who have led the way to this landmark achievement of developing and launching the Sanitation Policy Guidelines, or as we now know, the ASPG. With the successful launch, just a few months ago, now it's really time for action to support the rolling out and adoption of these policy guidelines across African countries for transformative and accelerated sanitation delivery. Despite the considerable progress we've made in sanitation coverage in recent years, achieving sanitation for all will still require an ambitious and well-coordinated scale-up. As we know, the world is not on track to achieve SDG 6.2 target. Still, 3.6 billion people lack safely managed sanitation. 1.7 billion lack basic sanitation, and still just around 500 million people are practicing open defecation in 2020. 2/3 of people who still lack even basic sanitation services lived in rural areas, and nearly half of them live in sub-Saharan Africa. More efforts are required in sub-Saharan Africa to accelerate our progression towards our ambitions to reach these targets of sanitation for all. But overcoming these challenges of access to sanitation services calls for robust and long-term strategies to strengthen partnerships, collaboration that will guarantee and sustain support and mobilization of political leadership and investments to accelerate this sanitation service delivery. From UNICEF's side, we are committed to support AMCOW to provide the necessary technical support for uptake and adoption of the ASPG across Africa. Together with close partners like my colleague Eric from BMGF, we will be supporting AMCOW to roll out the ASPG starting in 2 countries this year, with an initial focus on leveraging our work with the Joint Monitoring Program to support improved data on sanitation as an entry point for evidence-based policy and planning processes. We hope to provide further support to disseminate the ASPG across Africa through high-level events, webinars, sanitation dialogue to ensure that all countries are supported in strengthening sanitation policies and implementation. UNICEF views the ASPG as a strategic initiative with the potential for Africa's leadership to influence other regions of the world in promoting policy, enabling environment for accelerated sanitation delivery. Accelerating sanitation progress in Africa is going to absolutely require mobilizing our political leaders to prioritize investment and the necessary resources in human resources capacities. UNICEF is willing to partner with AMCOW and other stakeholders as part of the ASPG rollout to galvanize this political leadership and position sanitation as a priority and force of acceleration for progress in Africa. All efforts must be made to support AMCOW and national government on ASPG rollout and adoption through a well-articulated plan and strategy to be developed and implemented under the leadership of AMCOW. I would like to encourage all partners and relevant stakeholders to provide this required support to AMCOW and be part of this exciting and transformational ASPG movement. We need this to create a strong and vibrant policy environment for accelerating progress towards SDG Target 6.2. Together, we can work together to influence political prioritization and mobilize strategic partnerships to unlock new investments for sanitation service delivery across the African continent. While the sanitation challenges in Africa are formidable, we have a real opportunity through the ASPG to rekindle hope and re-energize the sector with innovative approaches for accelerating sanitation progress. Let's join forces for the sanitation transformation in Africa. This will be an incredible boost for the health and well-being of today's children and an incredible legacy that we can put in place for the benefit of future generations. Thank you very much, and I wish you a fruitful discussion today.
Thank you to Kelly for those very, very important remarks. And now, ladies and gentlemen, before we round up, our time is almost up. I'll call on my colleague, Tanko Azika, to give the close.
Thank you very much, Keith, for this opportunity. I think you will have all agreed with me that we were the lucky ones because this attendance was very good. That cuts across donors, CSOs, the private sector, and I also saw member states of the African Union. So I want to say thank you so much for your participation. Our dear panelists, Kelly Ann, Mr. Eric, Mr. Kimati, and Honorable Adamu, it was very good for your input. Once again, we thank you so much for participation. Thank you.
And dear colleagues, that's the end of our session. Please send us questions on the Portable Chat platform, and we can be able to respond, or any of the panelists will respond. And on that note, it's bye from us here. Have a good day. Bye-bye.